Welcome back, and thank you very much for staying with us. Well, you'll remember that President Cyril Ramaphosa announced that land borders will be closed until February the 15th to avoid a fatal ground for COVID-19 infections. And there are exceptions which include transportation of fuel, cargo and goods, the return of South African nationals and the departure of foreign nationals. So let's take this further as we have been also talking about the happiness index of South Africans regarding the current development. We are joined by Sonwabile Henma, who is a tourism lecturer at the Tswane University of Technology. Sonwabile, thank you very much for joining us.
Always a pleasure, sir.
Well, firstly, surely there would be discontentment regarding the decision that has been taken by the president, but surely it was crucial.
Well, we don't blame the president in closing land borders because already several countries around Africa have closed their borders, such as Zimbabwe. And this is obviously done to try and prevent the spread of COVID infections into South Africa because we've got a fragile healthcare system. So we in the tourism industry obviously understand that we have to preserve lives before we can preserve jobs because we will once again work again.
So now, in the meantime, we have been seeing some provinces having a surge in the infection numbers. But surely you have seen the social media abuzz with videos that were taken at the borders where there was so much congestion, no social distancing, people not wearing masks. For example, at the Beitbridge border, Lebombo border post. But as well, you might have as well observed what happens between Lesotho and South Africa, people crossing the rivers to make it to South Africa. Surely the issue of porous borders is something that really is a concern regarding the surge in COVID-19 infections.
Yes, sir, if you look at a Beitbridge, the issue of congestion has always been there. It has just been further precipitated by the issue of COVID testing, which happened at the border post, and checking whether the people that are coming do have the required documentation. But I believe, as South Africans, we need to have a serious reflection on how we treat a lot of our guests that drive by road into South Africa. And that's completely different to how we treat tourists that fly into OR Tambo, that fly into King Shaka, and that fly into Cape Town International Airport. So it requires a serious reflection because we cannot require people to come to our country, but obviously have those inefficiencies at our border post. I think it's quite unfortunate. I think there is enough money to improve how we service our people and ensure that they have an exceptional experience when they come to our country. Remember, the bulk of tourists that come to South Africa by road.
Sonwabile, when it comes to bread and butter issues, business people are really, having mixed reactions towards the level 3 adjustments, especially restaurants and the tourism sector. Some were arguing that the ban of alcohol was really harsh and unfair because when you look at the measure that was put in place before, they would be able to serve alcohol between Monday and Thursday, especially like liquor outlets as well. So the issue of trauma as well can be used to counter that argument. So what do you make out of this latest adjustment, which was left as was? And of course, looking at how the tourism sector and the hospitality sector has been affected, and what can be done so that there can be a measure of trying to balance the scales?
Unfortunately, the tourism industry can do nothing. We have tried to lobby Britain even last year about the liquor sale. Because if you look, the minute you stop the sale of alcohol, your restaurants cannot operate, your bars cannot operate, and your bars and restaurants are buying food from the farmers. So there is a knock-on effect that happens. And obviously, when liquor is not sold, then people do not come and buy. They don't come to these establishments because liquor is not only a big draw card, but it's also one of the biggest balance sheet earners for establishments. So by closing it, you're basically saying the tourism industry must actually die. Because to be honest, If you go to eateries all around South Africa, you'll find that the people are not there because alcohol is not being served. But to just be honest, there is no COVID-19 in alcohol. And this untruth that alcohol leads to increases in trauma units, I think it's a serious untruth. The reason why we've got COVID infections is because there's been increased movement. And the one thing we've never looked at is that South Africa does not have a functional healthcare system. Instead of blaming alcohol for the inability of government to have a functional healthcare system, we blame alcohol. And I think it's quite unfortunate.
So let's talk about what can be done regarding the argument concerning alcohol. Other people are saying that when you sell alcohol at restaurants, people don't fight, they don't kill each other. But when you sell them at taverns, people get a little bit crazy and mad at each other. So what do? Do you close the taverns and let alcohol be sold at restaurants? And will it be unfair? You remember last year there was an argument about the issue of wine tasting. That why should there be wine tasting in Stellenbosch when people in township cannot even taste the wine?
I believe we must always take decisions that are based on science, not based on our pre-held ideas about our population. The vast majority of South Africans will buy their alcohol in taverns, and you cannot tell me there is a mad in each and every tavern in South Africa. So it is very, very important that whenever government takes decisions, it takes them based on fact, not on fiction. And to be honest, on the alcohol issue, the government led by President Cyril Ramaphosa has taken decisions based on fiction, not fact. And we still await the science for them to present it. And they have not been forthcoming with the science because they know they don't have a leg to stand on.
So now, going forward, Sonwabile, what should happen after the 15th? The numbers are really showing a slight drop at the moment as they progress. But on the other hand, the president referred to that picture that was posted on social media where at Baragwanath Hospital, the Christian Baragwanath Hospital, there was actually evidence that the trauma unit was empty since the ban of alcohol. So now what happens?
First and foremost, the president has not have a valid reason to indicate that whether that picture is valid and truthful. So it is quite concerning if a president can post such a picture without firstly finding out whether that picture is a true reflection of the trauma unit. And I've got my reservation about that picture. But going forward, speaking about the future, for the tourism industry, the first thing we must be doing is that we must continue marketing ourselves to our South Africans, number one. Number two, we must engage with the stock-sell economy. People are saving money for December, saving food. We must encourage them to save an extra 100 rand for a packaged holiday within our country. And I believe we'll start having those conversations, then at least the tourism industry, when COVID ceases, then the tourism industry will be at the right pace to basically benefit from increased visitation, primarily from South Africans.
All right, so just very briefly, let's talk about the behavioral aspect of South Africans in as far as consumption of alcohol is concerned. We know very well that the road accidents also have alcohol being attributable as one of the causes of people either capsizing or head-on collisions and so forth. And secondly, I mean, like, it's very clear, like the prima facie evidence is that when people have had a fight, it might have been, or most probably might have been at a place where people drink in a public place. So then what would happen after the 15th? The numbers are dropping now. Should the alcohol ban remain irrespective of what is happening?
The alcohol ban is in violation of constitutional rights to decide. The alcohol ban remains irrational and unconstitutional. And the abuse of the Disaster Management Act by the current administration is quite regrettable and is wrong. And I await the constitutional judgment on this. But speaking about behavior, let's always understand that since 1994, the number of police that we have employed has not been at the same level as how our population has grown, as how our cities have grown. So the issue that the police might not be able to fully implement these regulations because there are less of them. So if you find issues where there is no compliance, that is because you might find that there are not enough police, or the police look at the resources such as vans and automobiles to go to these sites that are regarded as reckless in not following the protocols.
So on a parting shot, Sonwabile, irrespective of how thirsty one could be for whiskey or beer, the numbers are dropping. So what do you say about that?
Well, the unfortunate part is that the black market is operating at full profitability right now. Others are already producing their own type of beer, and for lack of a better word, Uber alcohol is fully in operation in South Africa, and that has got implications for the future. That is because that even though the alcohol ban can be seized and we go back to normal, people will still be able to buy alcohol after hours because Uber alcohol now operates, and that is now a reality of the lockdown regulations, which will still tend, most of them, irrational and unconstitutional.
Thank you so much for speaking to us this afternoon. Sonwabile Henma is the tourism lecturer at the Tswane University of Technology, right here on SA Today.